Fetal week 17. Congratulations, you're halfway through your pregnancy. After 16 weeks, your body and your baby's body have undergone many significant changes. However, some pregnant women still do not look pregnant thanks to their slim belly that helps to partially cover the growing second round. If you do not want to reveal that you are pregnant, you just need to cleverly choose maternity clothes to cover your belly. During pregnancy, you often have a habit of comparing your belly size with other pregnant women. You should know that each person's pregnancy will not be exactly the same. So don't worry if your belly is small and you still don't look pregnant. You may often hear from your mother-in-law and neighbors some advice. However, in practice it is impossible to know the exact size, growth, and sex of the fetus based on the appearance of the mother's womb. It's time to think about preparing a place to eat and sleep for your baby. During the first 12 months of life, the crib is the safest place for your baby to sleep. Put it next to your bed for easy monitoring and care of your baby. At this time, you begin to have the need to buy clothes and necessary items for babies. However, it is necessary to consider carefully to choose to buy the items that are really necessary for the baby. If your budget is tight, the best solution for you is to buy used or installment products. You can also borrow or ask from friends and relatives who have just had children. However, if you are planning to have another baby, invest in buying the best stuff from the start so that you can use it for the rest of the baby's physical changes at 17 weeks of pregnancy. When you are 17 weeks pregnant, you will be gasping for breath and will feel more tired. The circulatory system must work hard to pump blood to the body and through the placenta to the baby. Therefore, you need to make sure to supplement with nutritious foods rich in vitamin C and iron found in beef, green vegetables, whole grains and fresh fruits. Increased body temperature makes you feel hot and sweat more. This makes you not want to wear thick clothes. Fans and air conditioners can help you feel more comfortable. You should also shower regularly with warm water and avoid wearing synthetic fabrics. You should be careful with urinary tract infections. The female urethra is short and close to the two vaginal organs and the anal opening, so it is easy to cause retrograde infection. A simple but very effective preventative measure is personal hygiene, daily hygiene of the genital tract, urinary tract, before and after sex. At the same time, always wash and wipe the private area from front to back every time you go to the toilet to avoid the phenomenon of introducing bacteria into the urethra causing infection upstream. In addition, daily you should practice drinking plenty of water and should not try to hold back when you have a need to go to the toilet. Don't rush, but give yourself enough time to settle everything in your stomach. Say goodbye to your waistline because your uterus is now as high as your navel. Don't worry, you will get back in shape after giving birth. This week, you may experience heartburn during pregnancy. Increased hormone levels during pregnancy slow down digestion, which means food stays in the stomach longer, causing more acid to be secreted. A burning sensation in the back of the chest occurs when the lower esophageal sphincter relaxes. These muscles are responsible for keeping substances in the stomach, causing acid in the stomach to back up into the esophagus. This makes you feel like vomiting, especially after eating spicy foods like curries. Maintaining a healthy diet will help prevent heartburn during pregnancy. You need to increase the amount of liquid foods, eliminate foods that cause heartburn like spicy foods, baked goods, chocolate, coffee, wine, beer and carbonated drinks. In addition, you should raise the pillow a little higher than usual when sleeping. If heartburn symptoms are too uncomfortable, affecting daily activities, you should see your doctor for advice on using an antacid. Mental changes. At 17 weeks pregnant, you eagerly look forward to your baby's lovely movements. You often get in the habit of placing your hand on your belly and waiting for your baby's gentle movements to make sure your baby is still growing healthy. At this stage, you tend to focus all your attention on the fetus. This helps you prioritize do's and don'ts during pregnancy. Depression is also common during this period, especially for pregnant women with a history of neurasthenia. Don't eat your worries alone, share your concerns with your doctor, and don't hesitate to ask your loved ones for help when needed. 17 weeks pregnant changes. The 17th week fetus is about 13 centimeters long from the crown of the head to the rump. Baby's skin is so transparent that blood vessels under the skin can be seen. It is too early to form subcutaneous fat layers. However, this week appeared a special substance that helps the baby protect internal organs from the impact of the external temperature of the environment after birth. A thin, lustrous white layer known as plastid covers the baby's body, which protects the skin in the amniotic environment and helps the baby move more easily. Most babies continue to carry this sticky white matter after birth. Your baby is beginning to swallow amniotic fluid, and the kidneys have started working to produce urine. If you have an ultrasound this week, you'll be able to see your baby's kidneys. The first hairs appear on the top of the head, and a fine layer of hair covers the entire body. Usually, premature babies are born with a lot of fluff on their backs and arms. Some babies tend to go bald for several months and have a tuft of hair growing on their head. Note that the development of each fetus is completely different. The above are only the most general developments of the fetus in the respective period. At this stage, the baby will sleep a lot and accumulate energy for the formation and development of the body. However, you will notice the baby's activities when he turns and moves, especially when you are sleeping. Tips when you are 17 weeks pregnant. A problem that often appears when a mother is 17 weeks pregnant is dizziness. Some mothers are quite worried when they suddenly feel dizzy while working or walking. This is a common phenomenon for 17-week-old mothers, so you don't need to worry too much about this. When dizzy, mothers should refer to some of the following remedies. Mothers should lie down, lean to the left side, then raise the leg very high. If you can't lie down, you can sit with your head down between your knees. Mother needs to calm down, breathe deeply, and at the same time, relax her body and loosen the clothes that make her feel cramped and uncomfortable. What tests should I do? Measuring fetal heart rate. Check the amount of protein and sugar in the urine. Measure blood pressure and weight. Measure the distance from the bottom of the uterus. External palpation to check the size of the uterus. Check the mother's arms and legs for varicose veins or swelling. Besides, the mother should also discuss with the doctor about the unusual symptoms that she has experienced in the past time and prepare a list of problems that she has questions about to discuss with the doctor more conveniently. What should mothers do at 17 weeks pregnant? If you haven't scheduled a pregnancy ultrasound yet, this is a very good time. Mid-pregnancy ultrasound can take place between 18 and 22 weeks to check fetal development, including the formation and development of the brain, heart, spine, liver, kidneys, and internal organs. At this point, you can know the exact sex of your baby through ultrasound because the external genitalia are fully developed. If you want to surprise you and your family, tell your sonographer not to reveal the sex of your baby until the day you give birth. Talk to your baby often from the time you are in the womb. From week 17, your baby can hear and distinguish your voice. Invite your husband to enjoy the joy of noticing your baby's movements. Exercise for pregnant women and moderate exercise to ensure a reasonable weight during pregnancy and also help you reduce the risk of gestational diabetes. You should join Thai teachers' classes, practice useful exercises, chat and share pregnancy experiences with other pregnant women. Like, share and subscribe to update baby care experience. BABYANDI, The Journey of Being Mommy.